may I invite the next group to join the stage with such an interesting topic about Prehabilitation. What's the best approach for cancer and surgical patients? Presented by Ms. Arpanun Nitayamekin.
Good morning, distinguished guests and fellow delegates. My name is Arpanun Nitayamekin, a fourth-year medical student at Sirindhorn University. The incidences of cancer is increasing each year due to aging population. 45% of all cancer patients undergo surgery as part of their treatment. Surgery can produce a stress response on the patient's body, causing post-operative complications, prolonged length of hospital stay, and hospital readmissions, all of which are associated with decreased quality of life and increasing cost of care. Prehabilitation is an intervention that's administered during cancer diagnosis up until surgery, can help prepare patients to undergo surgery by increasing baseline functional capacity. Prehabilitation consists of 4 components: exercise training, nutritional support, psychological support, and behavioral change, such as controlling the underlying diseases. First, patients are screened for health risk assessment. Then they undergo prehabilitation for 4 to 8 weeks before monitored and go into surgery. There are many study designs on prehabilitation. However, due to different program designs, duration, and outcome measures, there are still conflicting results on clinical effectiveness. Therefore, this study aims to explore ex-cancer's perspectives on prehabilitation through a survey in order to design an effective prehabilitation program. The secondary aim of this study was to evaluate the effectiveness of prehabilitation on physical and mental fitness in current cancer patients undergoing a pilot prehabilitation program. The first part was a survey. It was developed by me and another researcher. It was then approved by the Ethics Committee of the University of Nottingham. The survey was distributed to ex-cancer patients who completed an exercise rehabilitation program at 3 sports centers in Nottingham. Survey was open for 2 weeks between November to December last year. Data was then analyzed using descriptive statistic and thematic analysis for the text responses. There were a total of 54 respondents. The majority were female, ages 51 to 70, with various types of cancer. What was interesting was that over 70% of respondents had to wait more than 3 weeks for surgery. 92% of respondents perceived prehabilitation in addition to rehabilitation to be beneficial in preparing them physically and mentally for surgery. 81.5% would have joined if it was offered. 20%, however, responded they would not have joined, with the main barriers being short waiting time, just 1 to 2 weeks, and transportation issues. Only a third of all participants reported receiving screenings of physical and mental health risks before surgery. And almost all participants indicated that good mental health was an influential factor for better outcome, and 61% would attend counseling classes. Patients preferred prehabilitation to be held in-center, which is in-person, or a mixture of center or home-based sessions, as being with other cancer patients give them more motivation and also being able to access for help and guidance on exercises by trainers. 3 themes were found from thematic analysis. The first one is support throughout the cancer journey was essential. Second, prehabilitation has to be flexible in terms of schedule and location. An efficient communication of prehabilitation was needed. The best approach for a cancer and surgical patient may be to introduce prehabilitation at the earliest point, which is through discussion with doctor at diagnosis. This could target patients with more than 3 weeks of waiting time. Structured screening tests should be used as routine to identify high-risk patients, so that patients are given information about themselves to prepare themselves better, and also for doctors to reevaluate treatment options. A patient-centered prehabilitation program should be multimodal, consisting of all 4 components while being personalized according to the results of their screening tests. The exercise session should be held in an environment of current and ex-cancer patients to create a safe psychological support network in order for them to share with each other experiences and concerns. And prehabilitation should offer a combination of in-person and online sessions, because some patients have to isolate at home during chemotherapy, therefore cannot join in-center. The second part of the program was a data analysis on current cancer patients undergoing who completed a pilot prehabilitation program at the Portland Leisure Center. They received an intervention which was a 1.5-hour session once per week consisting of exercise, which included a warm-up, 2 rounds of 8-station fitness circuit. The exercises alternate each week, a cool-down, and at the end of the session, they were given time to talk amongst themselves about the current state of their mental health. The data collected was a 6-minute walk test distance, which was a validated tool for measuring functional capacity, and a change of at least 20 meters is clinically meaningful, and a mental well-being score using the Worried Edinburgh Mental Well-being Scale. Data was collected pre-prehabilitation and after they completed the program just before surgery. Data was then analyzed using paired sample t-tests. There was a total of 11 complete data sets when the study was done. We found a statistically significant increase in the 6-minute walk test distance of 31.4 meters and an improvement in the mental well-being score of 6.4. Both were statistically significant. This therefore suggests that prehabilitation could help increase baseline functional capacity of patients and improve their mental well-being. Compared to other randomized control trials, the result was similar, which was an increase between 30 to 60 meters post-completion of the program. From this study, we have now gained perspective of cancer patients in order to design a patient-centered prehabilitation program that would be suitable to their needs. Data also suggests that prehabilitation would be beneficial in helping patients prepare for surgery. This study was a pilot study, therefore the number of participants was limited, and data collected was before surgery. Therefore, future studies should include larger size randomized control trials with comparable outcome measures to compare between different studies and also post-operative data. The survey could also be extended to healthcare professionals as service providers in order to help design an effective program. Prehabilitation is desirable by patient and is a valuable opportunity to help optimize patient before undergoing surgery. However, collaboration between different multidisciplinary teams is necessary and more evidence is required before it should be justified to be implemented as routine cancer care. Thank you.
Thank you for valuable information.
Do you have any comments or any questions?
Are there any other comments on the side effect or adverse event of the pre-rehabilitation program?
When data was collected, there was no reports of side effects. However, from different previous studies, side effects were not really reported. Yes. But from my study, the data collected was already collected before I went to do the study, and we just had the 6-minute walk test data and the mental well-being score. Therefore, side effects were not recorded.
Any more questions? In three sites of program, you use 3 gymnasium in this program, right? How to control the program that exactly the same?
For the first part, it was the survey. It was distributed to 3 participants of 3 sample groups, which is 3 sports center. Therefore, it was not a randomized controlled trials. But the second part of the program, which was the data analysis, it was only conducted at the Portland Leisure Center, which was 1 center.
Any more questions? Okay, thank you so much.
Thank you.